The majority of people are unaware that pancreatic cancer is among the most deadly tumors now recognized, subtly outpacing breast and prostate cancer in terms of mortality rates in numerous nations. Even more concerning is the fact that, in spite of its growing numbers, it still goes unnoticed and receives little public attention. Imagine being able to help someone you care about, or yourself, catch this illness before it's too late, by being aware of a few important indicators. There's a reason why pancreatic cancer is frequently referred to as a silent killer. It is an expert at hiding in the body, taking over 65,000 lives annually in the United States alone, and has a 5-year survival rate of about 12%. The horrifying thing is that about 80% of patients ignore early warning indicators, dismissing them as trivial problems or normal discomforts, until the disease has progressed and spread. The important thing to remember is that there is a rare window of opportunity for early detection because research now indicates that many of these symptoms begin to manifest as early as 3 to 6 months before a diagnosis is made. Despite its small size and location deep within your abdomen, the pancreas performs a huge amount of work. It creates essential digestive enzymes and aids in blood sugar regulation. Tumors can grow covertly without raising an instant alert due to their hidden location, which makes it even more important to recognize subtle warning indications. In this video, we'll show you 8 unexpected symptoms of pancreatic cancer, some of which are so prevalent that they're frequently completely disregarded. The groundbreaking discovery is that, based on current scientific studies, identifying only 3 of these symptoms combined may increase the likelihood of early identification by about 70%. Why is this fatal illness still so often ignored? Why isn't this information discussed in regular health conversations? In order to stay up to date on health issues that can actually have an impact, please remember to like and subscribe to this video if you find this information useful. Let's begin with the first crucial indicator. 1. Digestive issues. Through a number of interconnected pathways, pancreatic cancer has the ability to seriously impair your digestive system. By generating essential enzymes that aid in the breakdown of fats, proteins, and carbs into forms your body can absorb and utilize, the pancreas plays a key role in digestion. Tumors that grow in or close to the pancreas can disrupt the synthesis of enzymes or obstruct the pancreatic duct, leading to a series of digestive issues that can be upsetting and uncomfortable. Food may stay in the stomach without adequately breaking down as the digestive process deteriorates, resulting in bloating, vomiting, and persistent nausea, as well as general digestive distress. As the body struggles to digest nutrients effectively, this disruption eventually results in a noticeable decrease in appetite. This further impairs the body's resistance by frequently resulting in inadvertent weight loss, muscle atrophy, and nutritional inadequacies. A noticeable alteration in the look of stool is one especially striking indicator of poor digestion. Stools may become pale, oily, and unusually foul-smelling due to the body's inability to effectively break down and absorb lipids. This is a warning sign that is frequently disregarded. This is the body's way of telling you that something more serious is amiss, not just a small intestinal irritation. It could save lives to identify these alterations in the digestive system as possible indicators of pancreatic cancer. Even though these symptoms may initially appear nebulous or nonspecific, knowing how they relate to pancreatic function offers a critical opportunity for early discovery and perhaps improved treatment results. 2. Physical weakness or fatigue. The body can be weakened by pancreatic cancer in ways that go well beyond ordinary fatigue. This isn't the type of exhaustion that follows a hectic day or restless nights. It's a profound, unrelenting fatigue that persists even resting. You can wake up feeling as though you didn't get much sleep, even after a full night's rest. Cancer cells gradually deplete the body's stocks of energy and nutrients by competing with healthy cells for these resources inside the body. Walking, climbing stairs, and lifting light objects are examples of simple daily tasks that can feel overpowering at times, making daily living a constant struggle. However, the body is not the only thing that suffers. This physical weakness is frequently accompanied by mental difficulties, such as dissatisfaction, anxiety, or melancholy. A lot of people also have trouble sleeping, which exacerbates their tiredness and starts a vicious cycle of mental and physical stress. The fact that chronic weariness is so easily confused with stress, aging, or overwork is what makes it so deadly. In contrast to ordinary fatigue, it is not alleviated by relaxation or rest. Rather, it persists and gradually gets worse over time. Since it may be one of the few early indicators of pancreatic cancer, identifying this chronic, unwavering exhaustion is essential to getting medical help as soon as possible. 3. Shivering and fever. Your body's reaction to the inflammatory effects of pancreatic cancer is sometimes indicated by fever. The natural defense systems of your immune system are activated when your pancreas gets inflamed. Because they frequently come and go, these temperature swings can be very perplexing. You may have intervals of high fever interspersed with episodes of extreme cold and shivery feeling. The consistent fever you may get from common diseases is not the same as this trend. Temperature abnormalities can be exacerbated by the combination of pancreatic inflammation and jaundice. In essence, your body is battling the cancer itself, inflammation, and bile duct blockage on several fronts. These fevers are frequently accompanied by general discomfort and nocturnal sweats. These temperature changes often last or repeat, in contrast to viral illnesses that usually go away after a week. 4. Clots of blood. The significant impact that pancreatic cancer has on blood coagulation is among its most frequently disregarded and underappreciated side effects. Few people are aware that pancreatic cancer can subtly create the conditions for potentially fatal blood clots, even though many people only identify cancer with tumors or discomfort. This disorder, called hypercoagulability, makes blood clotting far more probable than it should be, particularly in the leg's deep veins. DVT, or deep vein thrombosis, is a common consequence that usually manifests as reddish or bluish discoloration in the affected area, warmth, pain, and inexplicable leg swelling. Even though these symptoms might not seem serious at first, there is a concealed risk. A pulmonary embolism is a potentially fatal medical emergency that can occur if a piece of the clot breaks loose and enters the bloodstream and travels to the lungs. The root reason of this process is what is so concerning. Inflammatory chemicals released by pancreatic cancer throw off the body's normal clotting equilibrium, putting it at risk for excessive clot formation. Inside the body, this produces an ideal environment for clots to form silently and suddenly. A rapid or erratic heartbeat, sudden shortness of breath, and severe chest discomfort that gets worse when you take a deep breath are all clear indicators of a pulmonary embolism that should never be disregarded. Since minutes can make the difference between life and death, these symptoms require emergency attention as soon as they appear. Knowing the connection between blood clots and pancreatic cancer can help patients and their families remain attentive. Realize that sudden swelling or breathing problems might be far more serious than they seem, and seek care right once to save lives. 5. Liver or gallbladder enlargement. When pancreatic cancer starts, it can spread to other organs in the area, including the liver and gallbladder. The bile duct, an essential conduit that transports bile from the liver to the small intestine, is frequently blocked by pancreatic tumors, which results in these alterations. When bile backs up, your gallbladder, which is typically around the size of a small pear, can dramatically grow. Your gallbladder keeps storing bile, but is unable to adequately release it because of the obstruction, which causes this enlargement. Likewise, bile buildup in your liver may cause it to swell. During a physical examination, this swelling may occasionally be felt as a firm protrusion under your right rib cage. These alterations are readily seen using contemporary imaging methods like CT scans and ultrasounds. These organs have a delicate and interdependent interaction. A domino effect is created when one system is impacted, affecting the others as well. Comprehending these associations aids physicians in solving the diagnostic conundrum. Because these organ changes can be important markers of underlying pancreatic problems, medical professionals frequently look for them during routine exams. 6. Bloating or gas. Your digestive comfort can be severely disrupted by pancreatic cancer in ways that many people initially don't anticipate or perceive. In order to facilitate easy digestion and nutritional absorption, the pancreas is essential for the production of enzymes that aid in the breakdown of fats, proteins, and carbs. This delicate process may be disrupted by a tumor that grows in or near the pancreas, resulting in prolonged bloating and strange fullness sensations. Feeling full after just a few bites is known as early satiety, and it's one of the first and most obvious symptoms. This occurs because the expanding tumor may compress adjacent organs, such as the small intestine or stomach, reducing their volume and changing how food is digested. Meals that used to feel normal can now make you feel tight, bloated, or even a little queasy. The bloating associated with pancreatic cancer is often chronic and obstinate, in contrast to the normal digestive pain caused by overeating or mild stomach upset. Common over-the-counter treatments like antacids and dietary changes frequently don't help. Even when you haven't eaten, your abdomen may feel substantially enlarged. This feeling can persist throughout the day and become hard to ignore with time. These symptoms are especially worrisome because they are so readily dismissed or misunderstood. Many people put off getting evaluated by a doctor because they believe they are experiencing age-related changes, stress, or dyspepsia. However, bloating, fullness, or tightness in the abdomen that persists for weeks without a known cause warrants careful consideration and a medical evaluation. In a condition that is frequently detected too late, identifying these subtle but persistent digestive alterations may provide a critical window for early discovery and intervention. 7. Back or stomach pain. Important details regarding the location of the tumor can be gleaned from the site of pancreatic cancer pain. Patients frequently suffer a unique kind of agony that is difficult to ignore when cancer develops in the body or tail of the pancreas. Imagine having a dull, lingering pain that seems to originate in the middle of your upper abdomen. Frequently, this ache spreads to your back, giving your torso a band-like feel. In contrast to normal stomach aches, this pain usually gets worse when you lie flat or after eating. Your pancreas is part of an intricate system of organs and nerves. A tumor's growth may put pressure on these nearby structures, resulting in pain signals. While some patients liken it to a continuous, intense pressure, others describe it as a gnawing sensation. This discomfort has a noteworthy pattern. At first, you may have intervals of respite as it comes and goes. But when the illness worsens, the discomfort frequently gets worse and lasts longer. Physicians can distinguish pancreatic cancer from other illnesses by knowing the features of your discomfort. Important diagnostic hints can be found in the nature, timing, and location of the discomfort. 8. Brown or dark yellow pee. Your health can be powerfully revealed by the color of your pee. Jaundice is a disease that frequently results from pancreatic cancer's impact on the bile duct. This happens when your body builds up bilirubin, a yellowish substance created when red blood cells break down. Your stool is typically colored because bilirubin is broken down by your liver and removed through it. This system is upset, though, when pancreatic cancer obstructs the bile duct. Your urine may become dark yellow or brown, like cola or strong tea, even if you're drinking plenty of water. This shift occurs as a result of your body's urgent attempt to get rid of extra bilirubin in other ways. Many people ignore this symptom, blaming it on food changes or dehydration. However, this color needs to be treated right away if it lasts longer than a few days, even with adequate hydration. This discoloration frequently manifests before other outward manifestations of jaundice, like skin or eye yellowing. For early detection, it may be essential to comprehend this early warning indicator. Although pancreatic cancer is frequently silent, its effects are profound. Not only is the disease itself deadly, but its symptoms are also readily disregarded and passed off as innocuous weariness, stomach problems, or minor discomforts. However, these indications are anything but typical, as we have shown. They are your body's subliminal warning signs that something is seriously amiss. You may be saving yourself or a loved one a significant amount of time by identifying even a few of these early symptoms, such as black urine, abrupt bloating, inexplicable exhaustion, or persistent back discomfort. It's time to get assistance. There is still time to take action. In actuality, life is saved by knowledge, ensuring further savings through knowledge. Imagine how many more people could get insight from this film if it helped you recognize the subtle symptoms of pancreatic cancer. In order to assist us continue disseminating important, potentially life-saving health information, kindly subscribe to our channel and enable notifications. We appreciate you viewing, and keep in mind that your awareness now could save someone's life tomorrow.